Hi everyone, and welcome to this pre-recorded session as part of the Acute Special Interest Group. My name is Jamin Mulvey, and I'm going to speak to you about mental strategies to optimise human performance in high-pressure environments, and focusing on the Columbia Icefields mass casualty incident. I am a ANZCA, however, I'm currently based in Canada, so I work as a paediatric anaesthetist at the Alberta Children's Hospital in Calgary. I moved here in 2013 after completing my ANZCA, and I now have about 0.3 to 0.5 of my FTE is in pre-hospital care, where I work as a medical director for the Shock Trauma Air Rescue Service. I also have recently come back from the London Air Ambulance last year. Unfortunately, that was cut short, and work in other pre-hospital arenas such as ski patrol, where I'm the medical director for the Sunshine Village Ski Resort and a faculty member for the Canadian Society of Mountain Medicine. In terms of disclosures, I've no conflicts to declare, no financial affiliations apart from working for the Air Ambulance, which is a charity. The opinions are my own and don't necessarily represent that of STARS Air Ambulance or Alberta Health Services. So today I'm going to speak to you about the Columbia Icefields, which you may or may not have heard about, and the mass casualty incident in 2020, and then finish up on the concept of human factors and strategic adaptation to pressure. So this event occurred in July last year in Western Canada in Jasper National Park, and the Columbia Icefields is the largest ice field in North America. It's located within the Canadian Rocky Mountains around the provincial border between the two provinces, British Columbia and Alberta. It's a truly amazing area, high alpine environment, mountainous, rugged, isolated, remote. It's very popular with tourists, and a lot of people come from all over the world to recreate there. People come to climb, to hike, to rock climb, to access the glaciers, to ski tour. A large number of people come to do glacial access, where they utilise these large buses as part of the activities. And this is one of the buses which was involved with the mass casualty incident. So this area is remote. The closest rural town would be approximately 100 to 140 kilometres away, and they are small community hospitals. Otherwise, this area really is rugged, mountainous, alpine environment. So the mass casualty occurred on a Saturday afternoon around 2:30 in the afternoon. I was actually off duty as part of, just had the day off, and I got a text in my role as the medical director for the STARS Air Ambulance, and the initial information was that there was an incident on the Highway 93, that there was a rollover, unclear information on exactly how many people, but number deceased, number critically injured, and that there was not a lot of assistance nearby, and that it was really in a difficult to get to location. Over the next sort of 5 to 10 minutes, there was more information come back and forth, and I offered my assistance in terms of that surge capacity, and was soon sort of dispatched as part of that surge capacity. Now, in terms of the air ambulance response, which I was involved with, this was part of a larger operation, which truly was a multi-agency, large-scale response, which involved lots of players. In terms of the aeromedical response, STARS Air Ambulance was able to dispatch 3 helicopters, and they are a formal air ambulance service in Western Canada. And their 3 bases, Grand Prairie, Edmonton, and Calgary, were approximately by road 450 to 500 kilometres away from the incident site. So you're talking large distances and large travel time. As part of the surge response, I was able to get onto an additional smaller helicopter with Alpine helicopters, which they run a long ranger as part of their rescue operations with the National Park Service. And in all of those helicopters over the next sort of 60 to 90 minutes converged onto that location. In addition to that, there were 5 fixed-wing assets deployed as part of the government's response, the Alberta Health Services, to utilise rendezvous. So for those of you that haven't visited this area, we're really talking beautiful, rugged, mountainous terrain. This is in the summer, and you can see there's still a lot of snow and ice. There's an all-year-round glacier to the west of the incident, but you could almost be forgiven for these photos, which I took on the way out to the incident, which is around 60-minute flight time, where you're passing along deep valleys and next to these rugged ridge lines and cliff lines, that you could be forgiven for thinking this was a tourist flight, but in reality we're heading to this mass casualty incident in this location. The next few pictures will just give you some overview to get a bit of a mental model of the hostile environment that we were working in. You can see the Athabasca Glacier at the bottom of the map. Where the X is where the bus, the glacier bus, or the snow coach that they call it, had rolled over. There was a staging site, which I'll show some pictures of. The access road to the glacier, which is a dirt 3-kilometre road. The yellow road there is the highway, which runs through the national park, with the closest towns being over 100 kilometres away by winding highway road. And then the casualty collection point, which was staged at the main car park for a visitor centre called the Icefields Discovery Visitor Centre. So that's the infographic or map, and this is what it looked like in real life. You can see there's the Athabasca Glacier. This is where the bus was rolled over, just below the access road. And this is quite a steep area. You can't quite appreciate it, but a very steep, rocky lateral moraine of a receding glacier. This is the staging location, and then the access road. Below us is a highway and the Discovery Centre, which acted as a casualty collection point. So as we were getting closer, the reality of this accident really started to take hold. So there were 27 people on board the coach that day, and due to COVID restrictions and 50% capacity, that was a lot better than a full capacity, which is over 50 people. And this bus had rolled over, had left that main road, rolled over a number of times, then landed on its roof. 3 patients were deceased. 22 were seriously injured. 12 of those are critically injured, so what we call a red category, so critically unwell. And 17 patients needed to be long-lined extricated, and this is a video of what that looks like. So in this country, they don't utilise winch aircrafts as much. Don't utilise winch as much, but the long line operations is a fixed line underneath the aircraft where they'll extricate patients, one patient at a time, in a horizontal position, obviously packaged. And this operation is performed by the visitor safety or mountain rescue operations as part of the national parks. So they were long lined or heli slung, one patient at a time from the incident site to the staging area, and then repackaged into the back of an ambulance 3 kilometres down this steep dirt access road to the casualty collection point. And that's where my first exposure to the patients and where we got inserted as part of that surge response. So you can see here, this photo was taken as we were coming into land at this location, but this is a large car park that had been secured as part of that response. You can see 2 formal air ambulances in the background there, the red helicopters. That's through the STARS or Shock Trauma Air Rescue Service, for which I'm the medical director. There's a helicopter with Edmonton at the front from Grand Prairie, and then a number of ground ambulances with ALS or advanced life support or basic life support skills. So as we land, we presented to the incident commander for that site, or the scene commander, and together with another physician from STARS who was performing advanced triage using ultrasound, they directed us into the back of one of these ambulances. I just want to state or note that these ambulances became resuscitation bays over the next few hours as patients were brought out one at a time from the incident site. And within these ambulances, they needed to be stabilised with the number of interventions and treatments, repackaged, and then transported either through helicopter, by fixed wing or ground, or a combination to the tertiary trauma centres, which were over 400 to 500 kilometres away. So there were many cases that day, many stories that I could talk about. I'm just going to highlight the first patient which we were directed to as a flash team and as that surge capacity. And we were told that she was in respiratory distress, that she had no IV access, and that she was the most critical of the patients as we arrived. And indeed, she was as advertised. So she had polytrauma, she had mixed obstructive shock, hemorrhagic shock, neurogenic shock. She had a flailed chest. She was hypoxic, hypotensive, tachycardic, hadn't moved her legs and couldn't feel from her chest downwards. She only had needle decompression done on the chest with no vascular access. So we immediately had a number of procedures to perform. We put in an IO, we supported her with vasopressors, performed an intubation and bilateral finger thoracostomies. We then handed her off to one of the other air ambulances that just arrived, where they started blood transfusion. They ultimately gave her 3 units in flight. She required ongoing vasopressor support, both to the hospital, but for another number of days afterwards due to neurogenic shock. And she stayed there at the trauma centre for stabilisation. So just going to go through the concept of pressure and some of the human factors that are involved with pressure and performance, and then discuss some strategic adaptation techniques. So strategic adaptation techniques, or high performance optimization, is an area of cognitive behavioral therapy and techniques, either mental skills, CRM or crew resource management skills, or human factors that allow individuals and teams to perform at optimum performance as the pressure increases. So what is pressure and how does it influence performance? So pressure is a continuous physiological or mental force that's exerted on or against an individual or a team or system. And unfortunately, the relationship to pressure and performance does not just continuously increase. As pressure increases or cognitive load increases, we get this curve, which is called the Yerkes-Dodson curve, or the arc of performance. We're all aiming for this zone where we have the optimal performance as pressure increases, where we're at our best, we have improved arousal or improved focus, thinking, communication, task completion. But unfortunately, as pressure increases, many of us enter the zone of frazzle. And this is a normal physiological response to increasing catecholamines, adrenaline, cortisol, where you experience degradation in performance. What we want to do is recognize this, not move into the state of freeze, but utilize techniques which we optimize our performance and push us back into the optimal performance state. So within research groups and certainly resuscitation groups and literature, people now talk about optimization strategies that you can employ before an event, during and after, but to the self, the team, the environment, and the system. I'm going to talk about the self, team, and environment in the next few slides. So many of you have probably seen high-performance sports and high-performance sporting teams either on the TV or as part of the Olympics. And what's been shown in these high-performance arenas is that the utilization of mental imagery is useful in terms of engaging parts of the brain to elicit emotional, physiological, and psychological responses to an event or a task. And if this is engaged appropriately and deliberately prior to an event or as a part of training, it can assist in decision-making, error reduction, improved focus, and task completion. Tactical breathing is used within the sports arena and certainly within the military to dampen down the effects of a hyper-arousal state or that increase in catecholamines. And indirectly, it's been shown to reduce your heart rate, your blood pressure, can help sort of calm things down through a structured depth and rate of breathing. So they talk about tactical breathing or controlled breathing or box breathing. And as a method, it's been shown to be very helpful to help control, calm things under pressure. Positive self-talk's also been used in order to shift your cognitive appraisal of a situation. So they talk about a threat appraisal or a challenge appraisal. Many people initially may get thrown into a threat appraisal in that emotional response to being thrown into a resuscitation environment, for example, and having mantras or phrases or words that you may say to yourself can help change your cognitive appraisal of the situation and gain some form of control. In highly unpredictable dynamic situations, it's useful to have predictable components that we can drill and shift the way we process information when we're under pressure. And drilling with repetitive, deliberate practice of discrete skills has been shown to be important, so that you don't really have to think about a procedure or a process, you just do it. So, for example, you can break down steps within certain procedures, such as central line insertion or arterial line or finger thoracostomy. You practice that over and over and over under conditions of increasing stress, strain, and challenge, and you can shift the way your brain processes information to maintain maximal bandwidth and take on more information. There are lots of techniques that people use for team communication. I'm going to highlight some which I've found useful. So the C's of communication, where people are calm, they're courteous, they're complete in their information, they're concise. The utilization of closed loop communication and repetition, so people give a command, it's acknowledged and then repeated back, either for acknowledgement or completion of that task. The importance of timing, so as a person delivering information, it's useful to recognize the right time to deliver that information. People under stress have tunnel vision. They can have auditory exclusion. They don't necessarily hear what is being said to them, or if they do hear it, they don't process it. So choosing the right time to deliver information is helpful. The use of standardized terminology for this mass casualty event, for example, with the use of incident command system and structure, and the terminology that went with that was important. Utilizing structured communication for handovers, for example, when you're under pressure, it can help to sort of organize your thoughts and have that delivered in a calm, concise manner. And then the utilization of rally points, where you can have a shared mental model and bring everyone together. In terms of environmental control, you'll all be familiar with having a calm, controlled environment, even for very sick patients, where you have a nice ergonomic workspace and you know where everything is and your next steps if there is an emergency. Within the pre-hospital environment, that's challenging. Certainly within this environment and this event, had a lot of challenges. However, the team in the time before all the aeromedical assets arrived utilised that time wisely. They were able to allocate and clear out a parking lot. They were able to increase the access and egress of ambulances. They were able to increase the access to patients through the channels that they developed of getting the patients to the casualty collection point and ultimately to the definitive hospital, and maintain their ergonomics. This becomes increasingly more important as situations get complex, and this is a photo from Paris, where they are performing ECMO for out-of-hospital VFRS, where they've organised their access to the patient, the ergonomics of equipment, and to some degree able to control the noise, light and temperature through various means, either on an individual level, so being dressed appropriately, not over or underdressed, but management of the patient as well. So there's lots of other techniques we could use. Some of them here include prioritizing tasks, to delegate tasks effectively, utilization of checklists and aids, to acknowledge that frazzle occurs in people and recognize it both within yourself and your teammates, and then the utilization of debriefs and self-reflection. So how did human factors play a role for myself and the team on that particular day? So just to remind you, I had the patient which I identified, which was one of 4 critically injured patients that we worked on that day as part of the flash team, had a polytrauma, mixed etiology of shock, with a number of procedures to perform and then hand over, and then reset and reframe to go on to the patient number 2. The mental skills that we were able to use and the human factors that came into play that day included mental imagery. As we were flying out there in the helicopter, which was a 60-minute flight out to the scene, took that time to cognitively appraise and decide this was a challenge and not a threat. In the last few minutes, as we were coming into the land, I utilised technical breathing or controlled breathing to help sort of calm things down, because I noticed that I was getting a little bit ramped up. As part of a team, we utilised closed-loop communication, rally points so that everyone was on the same page, and then delegated tasks appropriately. We reduce our cognitive load by utilising checklists. We prioritise those tasks appropriately, and we utilise skills that we drilled on previously. So rather than using analytical cognitive processing, we're able to use automatic processing. And then afterwards, as we handed off, we utilised the structured handover, had an after-action review, and really use the opportunity when we flew home after the mission and after our involvement in the mission, because the whole event lasted for over 12 hours of extrication time and transport time, and we were able to debrief amongst ourselves and have the opportunity to self-reflect. So in summary, I hope I've been able to demonstrate that similar to high performance areas such as sports and military, in medicine, it's not enough to just train the physical attributes of resuscitation and expect individuals and teams to perform consistently under pressure. We need to understand how the mind works, how it processes information, and recognize that high-level teams need non-technical skill utilization in order to perform at their best, whether it's for the individual, the team, or the system. Thank you very much for listening. Happy to take any questions in the live session, and otherwise, yeah, thanks for your time.